Vitamin B12 deficiency anemia. It is an hematologic disease. Look at this picture, shows that the signs and symptoms. Introduction. Vitamin B12 deficiency anemia is a condition in which the body does not have enough healthy red blood cells due to a lack of vitamin B12. This vitamin is crucial for production of DNA and red blood cells as well as for the proper functioning of the nervous system. Vitamin B12 deficiency anemia occurs when the body does not receive enough vitamin B12, leading to insufficient red blood cell production. This deficiency can result in symptoms ranging from fatigue and weakness to neurological changes. Types: pernicious anemia, an autoimmune condition where the body immune system attacks the stomach cells that produce intrinsic factors, which is necessary for B12 absorption. Second, dietary deficiency, common in individuals with poor dietary intake of B12, such as vegetarians and vegans. Three, malabsorption syndromes, conditions like celiac disease that impair the absorption of vitamin B12. For post-surgical states, individuals who have undergone gastric bypass or other surgeries affecting the stomach or intestines. 5. Medication induced deficiency. Certain medications like metformin or protein pump inhibitors can interfere with B12 absorption. Causes: 1. Malabsorption due to gastrointestinal disorders or surgeries. 2. Intrinsic factor deficiency seen in pernicious anemia. 3. Medications that affect stomach acid production, intestinal absorption. 4. Inadequate dietary intake, especially in strict vegetarians and vegans. Risk factors: age over 50. Second, vegetarian or vegan diet. 3. Gastrointestinal disorders. 4. Gastric surgery. 5. Long-term use of medications affecting stomach acid. 6. Family history of the condition. Complications: 1. Neurological changes, example numbness, tickling, balance issues. 2. Cognitive impairments, example memory loss, difficulty thinking. 3. Heart problems, example enlarged heart, heart failure, 4. Complications during pregnancy, example neural tube defects in the baby. 5. Increased risk of gastric cancer in pernicious anemia. Pathophysiology. Vitamin B12 is crucial for DNA synthesis and red blood cell production. A deficiency disturbs these processes, leading to the production of large, abnormal, and inefficient red blood cells. Megaloblastic anemia. Additionally, B12 is essential for the maintenance of the myelin sheath surrounding nerves, so a deficiency can result in neurological damage. Signs and symptoms. 1. Fatigue, weakness. 2. Jaundiced skin. 3. Shortness of breath and dizziness. 4. Numbness or tingling in hands and feet. 5. Difficulty walking due to nerve damage. 6. Cognitive disturbances, example memory loss, confusion. 7. glossitis, inflamed tongue and mouth ulcers. 8. palpitations and shortness of breath. 9. loss of appetite and weight loss. A diagnosis. 1. Complete blood count CBC shows large red blood cells, macrocytosis, and a low red blood cell count. 2. Serum vitamin B12 level confirms low level of B12. 3. Methylenic acid and homocysteine levels elevated in B12 deficiency. 4. Intrinsic factor antibody test helps diagnosis pernicious anemia. 5. Skilling test determines whether the deficiency is due to malabsorption. 6. Bone marrow bypass occasionally preferred to examine the morphology of red blood cells. Nursing diagnosis. 1. Fatigue related to decreased oxygen carrying capacity of blood. 2. Risk for injury related to neurological impairments, example numbness, tingling, balance issues. 4. Imbalanced nutrition, less than body requirements related to poor dietary intake or malabsorption. 4. Knowledge deficit related to lack of information about the disease process, dietary requirements, and treatment regime. 5. Activity intolerance related to generalized weakness and fatigue. Secondary to anemia. Management. 1. Fatigue related to decreased oxygen carrying capacity of blood. Plan. Encourage rest periods. and educate about energy conservation techniques. Intervention: monitor hemoglobin levels, provide a balanced diet rich in iron and vitamins. Second, risk for injury related to neurological impairment. Plan: ensure a safe environment and educate on the use of assistive devices. Interventions: assess, guide and coordination, provide full prevention strategies. 3. Imbalanced nutrition, less than body requirements related to poor dietary intake or malabsorption. Plan dietary consultation, educate about B12 rich foods. Interventions: monitor weight, provide vitamin B12 supplements. Treatment: 1. Dietary changes, increase intake of B12 rich food, meat, dairy, eggs. Second, oral B12 supplements for those with dietary insufficiency or mild deficiency. 3. Intramuscular B12 injections for severe deficiency or malabsorption issues. 4. Treat underlying causes, address any gastrointestinal conditions or adjust medications interfering with absorption. Psychosocial medicine: 1. Support groups connecting patients with others facing similar health challenges. 2. Counseling to address any psychological impact of chronic illness. 3. Education, providing information on managing the condition and improving quality of life. Prevention: 1. Dietary intake, ensure adequate consumption of B12 rich food. 2. Regular screening, especially in at-risk population like older adults and vegetarians. 3. Supplementation for individuals at risk of deficiency, example those with gastrointestinal disorders or on long-term medications that interferes with B12 absorption. Conclusion: vitamin B12 deficiency anemia is a manageable condition with proper diagnosis, treatment and preventive measures. Awareness of the risk factors and symptoms can lead to early intervention, preventing severe complications. Regular monitoring and balanced diet are essential for maintaining adequate vitamin B12 levels and overall health. Thank you. Have a wonderful day.